Hi, my name is Lindsay, and today I'm talking about the body's responses to steady state exercise. So what is it? This is a point during exercise at which demand for energy by the muscles and supply is met. Cardiovascular response. We'll just start with the heart rate. Your heart rate is how often your heart beats per minute. This is measured in beats per minute. As you start exercising, there's going to be a steep increase due to oxygen deficit and an increase in carbon dioxide. As you keep exercising, the heart rate eventually begins to plateau just because the supply of oxygen has met the demand of oxygen. This is known as steady state. When you stop exercising, your heart rate starts to decrease and is quite rapid. This is where your body is repaying the oxygen debt. Average heart rate is 70 beats per minute, but for an elite athlete it can range between 40 and 60. So stroke volume, this is the amount of blood that leaves the heart during each beat. The average for an adult is 50 to 70 at rest milliliters and 110 to 130 milliliters during exercise. This is compared to 90 to 100 milliliters at rest of an elite athlete such as Mo Farah and 150 to 220 milliliters during exercise. Stroke volume reaches peak during submaximal and cannot increase any further during maximal. So an increase in venous return can increase stroke volume. So this is just where deoxygenated blood returns to the heart. Veins contain pocket valves which prevent backflow and keep the blood flowing in the same direction. They are also located between skeletal muscles, and when these muscles contract, they help squeeze the blood back to the heart. This is called a muscle pump. A respiratory pump is when your breaths become deeper and faster during exercise, causing the pressure within the thorax to fluctuate, helping to squeeze the veins, and this forces the blood back to the heart. So this leads to an increase in venous return, leading to an increase in stroke volume. Starling's law, this just suggests that in the stroke volume can increase due to the filling of blood within the heart. This means that stroke volume is dependent on venous return, as this is where deoxygenated blood returns to the heart. Also, greater contractions of the heart during exercise can increase stroke volume, as with more force, more blood can be pumped out at the same time. For an elite athlete such as Mo Farah, their venous return would be greater than most people's, as their muscle and respiratory pumps would be much stronger, leading to an increase in blood returning to the heart, so that more blood can be pumped out. Cardiac output, this is the amount of blood that is pumped out of the heart every minute. This can be known as Q. The average is 5 litres per minute and can reach between 14 to 20 per minute during exercise. For an elite athlete such as Mo Farah, their cardiac output can reach up to 40 litres during exercise. This because their heart is more efficient and can pump more blood out due to stronger contractions. During exercise, your cardiac output begins to increase quite rapidly to also deal with the deficit of oxygen in the body, and also to remove carbon dioxide that is produced from exercise. It begins to plateau during steady state as the supply of oxygen has met the demand. Blood pressure is the force that is exerted against the walls of the arteries by the blood. When measured, it is split into two, systolic and diastolic. Systolic is the pressure against the arteries when leaving the heart, and diastolic is the pressure against the arteries when returning to the heart. The average is 120 over 80. During exercise, systolic can increase because the blood being pumped needs to be faster to supply the working muscles with oxygen. Also, an increase in cardiac output and stroke volume both increase blood pressure as more blood is leaving the heart. Diastolic remains the same or can decrease because the blood is being pumped out of the heart too fast compared to the blood coming back in. So vascular shunt refers to the distribution of blood around the body. During exercise, the vascular shunt redistributes blood to areas with the greatest demand for oxygen away from areas with lower demand. So, for example, redistributing blood away from organs to the muscles that are working. This helps to deliver more oxygen to the working muscles and also to remove more carbon dioxide from the body. For an elite athlete like Mo Farah, their vascular shunt would be more efficient by sending even more blood to their muscles so oxygen can be delivered and their muscles can work for even longer. So vasoconstriction is just the contractions of blood vessels and a narrowing of blood vessels so that blood can be redistributed faster to the working muscles. And vasodilation is where the blood vessels relax and expand. This slows the speed of the blood, and during exercise, the blood vessels close to the working muscles dilate so that more oxygen and nutrients can be delivered to the muscles. Now we're moving on to respiratory response and breathing rate. So as you exercise, a byproduct of muscular movement is carbon dioxide. This is poisonous, so we need to get rid of it. So we increase our breathing rate so more oxygen can enter our body. Breathing rate is the amount of breaths that you take per minute. The average at rest is between 13 and 16 and can increase to 40 to 60. During steady state, the breathing rate plateaus and becomes constant. It's because the demand for oxygen by the cells has been met by the supply of oxygen. For my Farah, his breathing rate will most likely be close to 60 breaths per minute during steady state, which is about 1 per second. This is to supply more oxygen to the muscles and to remove even more carbon dioxide from the muscles. There are two types of respiration. External is the first one, and this occurs in the alveoli in the lungs. So when you breathe in, there's a high partial pressure of O2 in the lungs compared to the capillary. There is also a high partial pressure of carbon dioxide in the capillaries compared to the lungs. Gas is diffused from a high partial pressure to a low partial pressure. So oxygen diffuses into the capillaries and carbon dioxide diffuses into the alveoli. Oxygen, when diffused into the capillaries, binds with hemoglobin to form oxyhemoglobin, and this is how it's transported in the blood. Internal respiration occurs at the respiratory membrane in the tissue. The oxygen diffuses into the working muscle cells from the capillaries, and the CO2 diffuses into the capillaries from the muscle cells. This is because there is a high partial pressure of O2 in the capillaries and a low partial pressure of carbon dioxide. So this causes oxygen to diffuse into the muscle cells and CO2 to diffuse into the capillaries. Between the capillary and the muscle, the O2 diffusion gradient is high. But between the muscle and the capillary, the CO2 diffusion gradient is high. This also causes O2 to diffuse into the muscle and CO2 to diffuse into the capillary as gases travel down the diffusion gradient. When you exercise, you increase the diffusion gradient, and temperature, CO2 and lactic acid cause a greater dissociation of O2 from the hemoglobin to the muscles. Tidal volume is the amount of air which enters the lungs during a normal inhalation. The average tidal volume at rest is 500 milliliters, and then during exercise it can increase to 2,000 to 3,000 milliliters. During exercise, carbon dioxide is produced, and increase in tidal volume is one way for your lungs to accommodate the exhalation of this increased carbon dioxide concentration. During exercise, your tidal volume will increase to deal with the oxygen deficit as deeper breaths allow more oxygen to enter the body. For elite athletes such as Mo Farah, they can train to increase their tidal volume further rather than their breathing rate. This is because deeper breaths allow more oxygen in compared to faster breaths, making it for a more efficient system. The oxygen dissociation curve shows the percentage saturation of hemoglobin with oxygen. When the hemoglobin molecule is full of oxygen, it becomes saturated. When the oxygen unloads, it is called dissociation. Association happens in the alveoli, as there is a high partial pressure of oxygen there. Dissociation happens in the muscle cells, as there is a low partial pressure of oxygen there. When the first oxygen binds to the hemoglobin, it slightly distorts it. This makes it easier for the second and third oxygen to bind, causing a steeper increase in saturation, as you can see in the graph. And then it begins to plateau because the fourth oxygen is more difficult to bind. During steady state, the dissociation curve moves to the right, and this just means there is a decreased oxygen affinity of hemoglobin, allowing more oxygen to be available to the tissues. An increase in temperature, an increase in carbon dioxide, and a decrease in pH levels can also shift the curve more to the right. Mo Farah would be working so hard that his carbon dioxide production and temperature would increase even further and the pH would drop further. This would shift the curve even more to the right so that more oxygen can be available to the cells. What controls respiration is the respiratory control center, and this is in the medulla oblongata and controls breathing rate and depth. The RCC has two different centers. They're the inspiratory center and the expiratory center. The IC stimulates inspiratory muscles to contract at rest and during exercise. The EC stimulates additional expiratory muscles to contract during exercise but not during rest. There are neural control factors that make this happen. So proprioceptors are in the muscles, tendons and joints, and these detect movement in the body and send a message to the RCC. Chemoreceptors detect chemical changes such as carbon dioxide. Baroreceptors detect the stretching of lungs. And then thermoreceptors can detect changes in temperature within the blood. And these will send messages to the RCC that can then send a message to the respiratory muscles, causing them to contract and can increase the rate of breathing and depth of breathing. So energy systems. The energy continuum helps to show how the energy systems work together to provide energy for ATP resynthesis. All three systems work together. Some may be more dominant, but they all work together. There are three systems. So the first one is ATP-PC. This works for about 3 to 10 seconds. The lactic acid works for about 10 to 180 seconds. And the aerobic system works for 3 minutes and above. So the aerobic system, there's 3 stages to it: aerobic glycolysis, Krebs cycle, and electron transport chain. The aerobic system can last up for up to 90 minutes and produces 38 ATP molecules. The aerobic system takes place in the mitochondria of the cells, as this is where aerobic respiration takes place. So aerobic glycolysis is the first stage and produces 2 phosphate molecules. This is where glycogen is broken down into glucose by the enzyme glycogen phosphorylase. The glucose is then broken down to pyruvic acid and 2 phosphate molecules. Pyruvic acid and coenzyme A then form acetyl-coenzyme A. If there are no more glycogen stores, fat can also be used, as lipase helps break down free fatty acids into acetyl-coenzyme A. So acetyl-coenzyme A then feeds into the second stage, which is the Krebs cycle, and this also produces 2 phosphate molecules and takes place in the mitochondria. The acetyl-coenzyme A combines with oxaloacetic acid to form citric acid. This then feeds into the Krebs cycle to produce 2 phosphates, 1 hydrogen, carbon dioxide, and oxaloacetic acid again, so it can be reused. The third stage is the electron transport chain, and it's the last stage and it produces 34 phosphate molecules. The hydrogen produced from the Krebs cycle is used to bond with 2 transport enzymes, NAD and FAD. This produces NADH and FADH. When the NADH is sent along the transport chain, hydrogen plus ions are made and also water is made. When FADH is sent along the transport chain, hydrogen electrons are made and 34 phosphate molecules are also made. So for an elite athlete like Mo Farah, when he's using steady state for training, he'll be using the aerobic system to supply the energy needed to resynthesize ATP molecules. This is because during steady state training he'll be training for more than 20 minutes. This means that it's too long for ATP, PC and lactic acid system to supply the energy for. But because the aerobic system is so long, it is able to supply energy for that period of time, as it also has a high yield of phosphate molecules, which means that ATP can be resynthesized a lot more. And that is it. Thank you for watching.